So I'm going to be having a look at your jaw, having a look at the muscles of your jaw, how your jaw opens, closes, and moves, just so I can get an idea of what's happening with the joint itself. And I'm going to have a look at your around your neck as well, and a little bit at the front here. So what I'll start off with is I'm just going to place my hands at the joint here, and I'm just going to ask you if you can open your mouth to the count of 3 for me. So 1, 2, 3. And is that as wide as you can go? Yep, that's great. Any pain?
No.
Okay, and close it for me. And I'm just going to ask you to do that again. So 1, 2, 3, and closing for me. Okay, that's good. So I'm just looking to see how it moves up and down, and also if there's any like deviation, if it moves towards one side or the other, either when you open or close your mouth. That gives me a little bit of information. And I'm just now going to palpate some of the muscles that are responsible for helping your jaw movement. So I'm just going to start up here with the temporalis. You just want to clench your teeth for me. Oh, that's great. Is there any tenderness?
No.
Through here? No. Okay, and I'm just going to put the masseter.
So when people come in, if they do have jaw issues, what kind of symptoms do they show with?
So they will have typically maybe like jaw pain, headaches, particularly in the temples. They might have difficulty opening and closing their mouth fully, or it might just be that when they open and close, it's painful, or they have pain chewing or swallowing. They also might hear popping or clicking sounds, or a crunching sound in one or both jaw, like joint. The clicking or popping sound may or may not, if there's no pain or sort of dysfunction in the opening and closing, that might not really be an issue. But if there is pain or dysfunction, then the popping or clicking can mean that there's an issue with the disc that's in the joint here. Okay. Sort of slides backwards and forwards when you open and close your mouth. Sometimes that's displaced forward or anteriorly, we call it. Yeah, so it's called disc displacement. So they're some of the things that might be happening. And neck pain often goes hand in hand as well, particularly upper neck pain.
So people can get jaw and neck pain together?
Yeah, they can, yeah. So I'll have a look along just the base of the cranium here. Sometimes headaches come from here as well.
So you can get headaches associated with jaw
Yeah.
dysfunction?
I mean, commonly the temporalis headaches are quite common, but tension headaches can also be associated with lots of academic headaches.
So in an assessment, you look at both the jaw function and the
and the neck and the upper neck. Yeah. Well, I'd look at all the neck really, but upper complex can be important because the nerves as well that C1, 2, and 3 also show nucleus in the brainstem with the trigeminal nerve, which is the nerve that is for the muscles, the masticating muscles of the jaw.
Right.
So sometimes you can get with bird pain. So I'm just going to have a look. There's some muscles under here that also help with jaw opening. So I'm just going to palpate along here. Any tenderness there?
No, it's fine.
And I'm just going to have a look at some of the muscles of the neck as well. And then I'm just there's a little bone here called the hyoid bone, which some of these muscles, there's little muscles underneath and above that help with the tongue movements. This is the hyoid bone.
Oh yeah, cool.
Yeah, can you see that?
Yeah.
It's a little bit weird. You have to be quite gentle. It can be a bit sensitive in this area. Okay, so what I might do now is I'll just do some work on your masseters first, just to release some of the tension, get a little bit of tension in these. So I'll do a little bit here.
So do you find this in people that clench? Or
Clenching or bruxism, clenching, grinding, that is definitely can be a common thing that people are doing if they've got jaw problems. Often at night as well. So many people, when they go to their dentist can often tell if they've been clenching or grinding because they'll have worn teeth, or sometimes the tongue will have this scalloped pattern around the edge of it because your tongue's being pushed up against the teeth. Yeah.
And do you always know if you're doing that or not?
Well, no, a lot of people say well, patients I've had say that they're often not even aware that they're doing it. I mean, not everyone wakes up with a headache if they've been clenching all night. So yeah, often people are like, oh yeah, I went to my dentist and they told me that I clench or grind my teeth just because they can tell from the teeth and the tongue.
That feels quite good. You can feel the releasing tension to the side of the cheek as well.
Okay, I'll do a little bit on your temporalis muscle. This can sometimes be quite sore and tight if you're clenching. Okay, some other things that we can do is we can actually mobilize the joint. So what I'll get you to do is just open your mouth a little bit just to make it relaxed for me. And then I'm just going to does that feel okay?
Mm-hmm.
And then we can sort of do a little bit on the upper complex here. And another thing that we can do is we can do work on the inside of your mouth, where there's a muscle called the lateral pterygoid is often harder to get to on the external.
Yeah.
So it's quite far up in the upper teeth in the corner there. So I'm going to take a couple of gloves. Just going to sanitize my hands first. Now this can be quite intense, so if it's too much, I want you to give me a signal of stop. It'll be a bit difficult for you to communicate with me with the finger. Yeah. Yeah.
So that's the work you could do outside, and now there's
exactly. So what I'm going to get you to do is I'm going to get you just to again open your mouth for me, just a little bit wider, and then I'm just going to put my finger up the back here and find the muscle, and then I'm just going to inhibit it a little bit on the outside as well. Give me a thumbs up if you're okay. And we can also get into the muscle a little bit here as well. Still okay? Okay.
That's quite strong, isn't it?
It's a strong technique.
But it's
it's quite a strong technique. Can also sometimes feel quite emotional. You can feel it in the your stomach a little bit, and some people can.